Welcome back to my channel. It feels good to have you back on this channel. And if you're a new visitor here, you're also highly welcome. In this lecture, we'll be looking at the coronary circulation. The coronary circulation is the blood supply to the heart. The heart is known as a pumping organ, which helps to feed the different organs in the body with oxygen and nutrients. And we would not say that because the heart pumps blood to feed different organs in the body, it does not also need blood to also carry out its own metabolic activity. So the heart is no exception because it is also made up of cells that need oxygen and also nutrients so that they can be able to carry out their metabolic activity and able to execute the function of pumping blood to the different organs in the body. And that is what backs the coronary circulation because the heart also needs the supply of the blood that it pumps. So let's dive into this lecture to see how the coronary circulation helps to feed the different regions of the heart with oxygen and also nutrients. The coronary circulation is provided by the coronary vessels. The coronary arteries are so named because of the pattern that they run encircling the surface of the heart. This is the coronary artery. This is another coronary artery here. We have two, one on the right and also one on the left. And if you see that the coronary arteries branch into sub-arteries that helps to feed the different regions of the heart with oxygen and nutrients. And if you see the way they branch, encircling the heart like a crown, and that is where the name is being drafted from, coronary artery, because of the pattern by which they run. The coronary arteries are referred to as the vasa vasorum, the vasa vasorum of the heart. Vasa vasorum generally are small vessels that are seen to supply medium-sized or large vessels. If you go through the development of the heart, we know that the heart developed from primitive endocardial tube. So this is the configuration that is shown here. And we have the emergence of the coronary artery from the ascending aorta supplying the wall of this primitive endocardial tube in this kind of configuration that is presented in this image down here. So this is the coronary artery supplying the wall of the primitive heart tube. So it is now seen as a vessel that emerges and supplying the wall of another vessel, which is of course going to develop into a cardiovascular structure after the developmental process is completed. So let's establish some facts, and this includes that blood flow generally into the arteries during systole. This means that blood will flow into different arteries in the body during the contraction of the heart. So when the heart contracts, the blood is pushed out of the heart, and this will be used to feed the different vessels in the body. So that is why when there is systole, that's contraction of the heart, blood is being directed into the arteries. This is the general phenomenon. But in the case of the coronary artery, this is different. During systole, it means the heart contracts, and we already established that the coronary vessels are seen to line the surface of the heart like a crown. So when the heart contracts, it means there's going to be a simultaneous contraction in the wall of the coronary arteries. And when there's contraction in the wall of the coronary artery, even if the heart pushes blood out, it will not be able to flow through the coronary vessel because the wall will be constricted. So that is why we say that blood flows into the coronary artery during diastole, which is the relaxation of the heart muscle. And when the heart muscle relaxes, it means the wall of the vessels that is also lining the surface of the heart will also relax, and blood will be able to be directed into the coronary artery. So this is a fact that we should know. So during systole, that is the contraction of the heart muscle, the coronary vessel will contract, and this will constrict the wall of the coronary vessel, thereby restricting the flow of blood through it. This is not a general scenario with other arteries, because when there is systole, that is a contraction of the wall of the heart will be able to push blood out to feed the different arteries in the body with blood. So this is a fact that we should know. Also to add that there is going to be an increase in the flow of blood within the coronary artery when the activity of the heart is increased. When the function or the activities that the heart exhibits increases, there's going to be more demand for blood, and the only vessels that will be supplying it with blood is the coronary artery. So there will be increase in the flow of blood within the coronary artery. Also, when there is decrease in heart activity, there's going to be a concurrent decrease also. This is understandable because the more the activities that the heart exhibits, of course, the more the demand of blood that it will need, and of course, there's going to be an increase in the coronary blood flow. So going further on the functions and also the importance of the coronary artery. The coronary artery, we've established that it is the only means through which oxygen reaches the myocardium, which is the heart muscle, because this is the only means through which oxygenated blood will be supplied to the wall of the heart. And of course, we know that the heart utilizes high amount of oxygen in being able to carry out its activities, because we know that the heart is continuously pumping blood to feed the different arteries in the body. It doesn't stop, it's a continuous process. And for it to be able to exhibit this continuous action, of course, it needs oxygen for it to be able to provide or avail itself with energy to be able to carry out this activity. So the heart is continuously working. Also to add that any disorder or disease that affects the coronary circulation will also have implication on other organs in the body. Why? Because we know that the heart will help to feed oxygenated blood to the different vessels in the body that is supplying different organs in the body. And if there's reduction in the supply of oxygen to these organs, their functions will also be impaired. So this is logical and of course understandable. The coronary circulation is also able to auto-regulate itself because of the presence of endothelium vasomotor that is seen within the interior wall. And this helps to maintain appropriate flow of blood so as to suit the need of the cardiac muscle. So let's dive into the coronary arteries. The coronary arteries help to supply oxygenated blood to the myocardium. The coronary artery is branched from the aorta. We know that the aorta is the largest artery in the body, and this is what feeds the other arteries in the body with oxygenated blood. So also the coronary artery. We have the right coronary artery and we have the left coronary artery. So this is the aorta, from where the coronary arteries emerge from. So we have the right coronary artery. This is the right coronary artery here, arrowed in black. And we have the left coronary artery. This is the left coronary artery, also here, arrowed in black. So we have two coronary arteries. We have the right and also the left. And we'll be taking each of these arteries one after the other to see where they specifically emerge from and also the branches that they give to supply the different regions of the heart. So let's start with the right coronary artery. The right coronary artery, from the name, it emerges from the right side of the aorta. But what specific region of the aorta does the right coronary artery emerge from? It is the ascending aorta. Let's look at this image here. This is the configuration of the heart. This is the right atrium. This is the right ventricle. And we have the left atrium up here. And we have the left ventricle also located down here in the left side. We know that oxygenated blood is directed into the aorta from the left ventricle. If you've not checked out my lecture on the heart, this is where we establish and explain this in details. Please kindly go and do so as to keep yourself updated. So from the left ventricle, we have oxygenated blood that is ready to be transported to the different arteries in the body so as to feed them with oxygenated blood, where the different organs can use the oxygen up to carry out their metabolic activities. So from the left ventricle, we have oxygenated blood, and this is directed into the aorta, and this is the aorta here. We know that the aorta is divided into sub-regions. We have the ascending part of the aorta, which is the initial segment of the aorta that emerges immediately from the left ventricle. Then we have the arc of aorta, which is the curvature that is created after the ascending aorta. Then we have the descending aorta, which is seen after the arc of aorta that tends to descend through the thoracic cavity and also the abdominal cavity. So the initial segment, which is the ascending aorta, is where we have the emergence of the right coronary artery. So this is the right coronary artery here. At the ascending part, this right coronary artery is quickly given off so as to supply the heart before the aorta proceeds in the journey to become the arc, then finally descending down as the descending aorta. So from the ascending aorta, we have the right coronary artery emerging just at this point to supply the right region of the heart. Let's dive in specifically to see where the right coronary artery emerges from. We know that it emerges from the ascending aorta. There is a formation of the aortic valve. This is the aortic valve here that is highlighted in black. This valve helps to control the path through which blood will flow into the aorta. So it's like a guide that helps to prevent the backflow of blood into the left ventricle. We know that we have oxygenated blood here in the left ventricle, and it is directed into the aorta. So there's a control channel are just around the emergence of the aorta so as to prevent the backflow of blood into the left ventricle. So this is the essence of creating this aortic valve. So if we try to extract this aortic valve, this is the kind of presentation that we would see down here. The aortic valve is made up of the aortic leaflet, and within the leaflet, we have spaces that are called the aortic sinuses. So this is the kind of presentation that we'll be seeing. Three pocket-like or semilunar valve, and this is what is seen in this image. So they have the right leaflet, they have the left leaflet, and they have the non-coronary leaflet. We would be able to establish why this is called the non-coronary leaflets during the course of this lecture. So there are three leaflets, and that is why they are called three semilunar valves. So this leaflet, of course, because it's pocket-like, so there's going to be like a space within it, and that is what is referred to as the sinuses. So we have the right aortic sinus, we have the left aortic sinus, and we have the non-coronary aortic sinus. These sinuses are just spaces that are created within the aortic valve. So within this pocket-like configuration, we have the sinuses, and this is what we've established here. So you see the right coronary artery emerging just above the right aortic leaflet, but from the right aortic sinus. Remember, we said that the right aortic leaflet is seen at the inferior part, and that is what forms the inferior limit of the aortic valve. Then inside the leaflet is where we have the space that is called the aortic sinus. So this is the right aortic sinus here, arrowed in yellow. So by the side of the aortic sinus is where we have the emergence of the right coronary artery, just above the right aortic leaflet. You can see how that is presented. There is a reason for this. And why this emerges in this kind of configuration can be justified, because when blood is directed into the aorta, the right aortic leaflet will guide or prevent the backflow of blood. And this space within here, blood will be contained within this region, but will be prevented from flowing backward into the left ventricle. And that is where the coronary artery, specifically the right coronary artery, will be able to trap the blood and allow blood to flow through it. So the essence of the emergence of the right coronary artery above the right aortic leaflet is justified, because if it emerges below the right aortic leaflet, the structure that will be preventing the backflow of blood will not be there, and blood will flow back into the left ventricle and will not be able to be directed into the right coronary artery. And this image can also be used to further explain the reason why blood flow into the coronary artery during diastole. During diastole, there's going to be the relaxation of the wall of the heart, including the coronary vessel. And when this relaxes, the blood that is supposed to be flowing back into the left ventricle will be prevented by the right aortic leaflet, and blood will remain within the right aortic sinus. And from here, they will be directed into the coronary artery. So that is how that application can be established. For the right coronary artery, after it emerges, let us see how it runs around the surface of the heart. It emerges from the right aortic sinus, as we've stated in our previous slide. And after it emerges, you see it between the right auricle and also the pulmonary trunk. This is the right auricle here in the right side of the heart, and this is the pulmonary trunk, which carries the oxygenated blood to the lungs where it will be oxygenated. And between these two structures is where we have the right coronary artery, and this is the right coronary artery here emerging just at the initial region of the aorta, and this is the aorta here. So as it emerges, you see it passing through along the right anterior atrioventricular groove. This is the right anterior atrioventricular groove. The right means on the right side, and anterior, of course, on the anterior side. And it is a groove that is created between the right atrium and the right ventricle. So this is the right atrium, this is the right ventricle, and you see the groove in between them, and this is the right anterior atrioventricular groove. The right anterior atrioventricular groove, this groove is also referred to as the right anterior coronary sulcus. It is the right because it's on the right side, and anterior because it's on the anterior side, and coronary because it allows for the passage of the coronary artery, specifically the right coronary artery. And of course, it is a sulcus or a groove. So it can also be referred to as the right anterior coronary sulcus. And you see this right coronary artery, passing through this groove, and it descends down, passing down towards the inferior border of the heart. And you see it at this region, finally turns, and you see it passing through the right posterior atrioventricular groove, which is seen at the diaphragmatic surface. Remember, we tried to establish this groove during our lecture on the right atrium. So we have the right posterior atrioventricular groove, just as we have the right anterior atrioventricular groove here. The right posterior atrioventricular groove is also referred to as the right posterior coronary sulcus. It is the right because it's on the right side, and posterior because it's behind, and coronary because it allows for the passage of the coronary artery, specifically the right coronary artery, and a sulcus because it is a groove. So it can also be referred to as the right posterior coronary sulcus, or the right posterior atrioventricular groove, because it is seen between the atrium and also the ventricle, but at the posterior side. So it passes through it, and you see it running posteriorly around the inferior border or the diaphragmatic surface of the heart. And this is the part by which it runs. So you see the right coronary artery directed towards the inferior or the diaphragmatic surface of the heart. And at this point, you see it passing through the right posterior atrioventricular groove. Remember, we have the right anterior atrioventricular groove here, which is in the anterior part. Because it turns and is seen on the inferior border of the heart, you now have the right posterior atrioventricular groove. So you still have a groove at this posterior part, separating the right atrium and the right ventricle. And this is the groove here that is demarcated in this image, where this arrow is pointing, and you see the right coronary artery passing through the right posterior atrioventricular groove. And this is what is seen here. You see it passing through it and is directed towards the cross of the heart. The cross of the heart is the junction where the atrioventricular groove meets with the interventricular groove. The atrioventricular groove is the groove that separates the right atrium from the right ventricle, and the interventricular groove separates the right ventricle from the left ventricle. So you see the interventricular groove here, and you see the atrioventricular groove here. At the point here where they merge is called the cross of the heart. So at this point is where it is directed to, and when it gets to this point, there's going to be a change in direction. You see it passing through the posterior interventricular groove, and this is the posterior interventricular groove. Using this image down here, this is where it emerges from. You know, at this angle, there's going to be a turn into the inferior surface of the heart, or the diaphragmatic surface of the heart. And around this part, you see it passing through the right posterior atrioventricular groove, and this is the right posterior interventricular groove at the posterior part, although facing the diaphragmatic surface. Then you see it directed towards the cross of the heart, and this is the cross of the heart, this region here. And this region is where we have the junction between the atrioventricular groove and also the interventricular groove. This is the atrioventricular groove, and this is the interventricular groove that separates the right ventricle from the left ventricle. So at this junction is where we have the cross of the heart. So from the cross here, you now see a change in direction. You now see where the right coronary artery will then be directed into the posterior interventricular groove. So this is the posterior interventricular groove, the groove that is created between the right ventricle and the left ventricle, but at the posterior side. So using this image up here, this is the path by which it runs. After being directed towards the inferior border of the heart, you see it coughing to the diaphragmatic surface, which is on the inferior surface. So this is where it passed through, and this groove is the right posterior atrioventricular groove. So this is the right posterior atrioventricular groove, or the right posterior coronary sulcus, as we've explained. So passing through this course, it is directed towards the cross of the heart. And at this junction is where we have the cross of the heart, which is the junction that is formed between the atrioventricular groove and also the interventricular groove. So at this junction, referred to as the cross, there is a change in direction. And that is when it is now redirected to pass through the posterior interventricular groove. And this is the posterior interventricular groove. And you see it tipping towards the apex. So finally, you see it passing through the posterior interventricular sulcus or groove. So this is what is seen here. And this is the groove that separates the right ventricle from the left ventricle. Also in this image down here, you see it passing through the posterior interventricular groove or sulcus, which is the groove that is created between the right ventricle and the left ventricle. So this is the pattern by which it runs. When it runs along this course, that's the posterior interventricular groove, it is directed towards the apex of the heart, but does not reach the apex of the heart. And at this point is where it stays. And of course, it waits here for branches from the left coronary artery, which we would get to as we go through with this lecture. The branches from the left coronary artery We then meet with it at this point where it's going to form an anastomosis with it. This is the configuration of the path by which the right coronary artery will move from where it emerges from down to the lower border of the heart before it cuts to the inferior surface of the heart, and finally you see it directing towards the apex of the heart, but of course does not reach the apex of the heart. So let's go further to see the different branches of the right coronary artery and the different regions of the heart that they supply. In describing the branches of the right coronary artery, it's good for us to subdivide it into the branches that emerge from the anterior surface of the heart, and of course the branches that emerge from the posterior surface of the heart. We established that at the lower border of the heart, it curves to enter into the inferior surface of the heart or the diaphragmatic surface of the heart. It gives off branches also in this region, and we'll be looking at those branches as the posterior branches of the right coronary artery. So we have the branches that emerge at the anterior surface of the heart, then we have the posterior branches that emerge at the posterior region of the heart. So for the anterior region of the heart, we have this list highlighted in red here. We have the right conus artery, we have the sinoarterial artery, we have the right anterior ventricular branches, we have the right atrial artery, and we have the right marginal artery. These arteries are branches from the anterior region, and these are the branches here: the right conus artery, the sinoarterial artery, the right anterior ventricular artery. We have the right atrial artery and we have the right marginal artery. So those are the branches that emerge from the anterior region of the heart from the right coronary artery. Then when it is directed towards the inferior surface of the heart or the diaphragmatic surface of the heart, it also has branches that emerge from the right coronary artery. We already said that when the right coronary artery gets to the inferior border of the heart, there is a turn onto the inferior of the diaphragmatic surface, and the branches that it gives at this region are referred to as the posterior branches of the right coronary artery, and this would include the right posterior ventricular arteries and also the posterior interventricular artery or the posterior descending artery, PDA. The posterior interventricular artery or the posterior descending artery will then further give off the AV nodal artery and also the septal branches. So those are the branches that emerge from the posterior region of the heart, and these are taken as the posterior branches of the right coronary artery. So let's go first to the branches that emerge at the anterior surface of the heart from the right coronary artery. So the first one is the right conus artery. The right conus artery, when we hear right conus, we should expect the left conus artery, and that will be coming from the left coronary artery. So the right conus artery is the first branch of the right coronary artery, and this is where it emerges from. It emerges like that, and this is the region here highlighted in black. This right conus artery can also emerge from the right aortic sinus. Remember when we tried to describe the emergence of the right coronary artery using the three leaflet or pocket-like semilunar structure of the aortic valve. This is the kind of configuration that we presented. We know that the right coronary artery will emerge from the right aortic sinus. We could also have the emergence of the right conus artery also from the right aortic sinus. And when this kind of presentation occurs, this is referred to as the third coronary artery. So the right conus artery can also emerge independently from the right aortic sinus, and when this happens, it's going to be referred to as the third coronary artery. So this right conus artery goes and it supplies the conus of the pulmonary trunk. In this image here, this is the right conus artery, and this right conus artery, we say, supplies the conus of the pulmonary trunk. The conus of the pulmonary trunk is where the pulmonary trunk emerges from, where it is being rooted from. And this is the pulmonary artery here, arrowed in blue. The pulmonary artery inferior to it, we have a region on the right ventricle where it emerges from, and this is the conus of the pulmonary artery. And it's this region that the right conus artery supplies. And that is where also the name is being drafted from. The right conus artery supplies the conus of the pulmonary trunk. And this conus is a conical pouch that is seen in the left upper part of the right ventricle. This is the right ventricle here. The left upper part of the right ventricle is called the infundibulum. This we established in a lecture on the right ventricle. If you also check that lecture, please kindly go and do so. This infundibulum is the left upper region of the right ventricle, which is the heart flow region of the right ventricle. And it is this region that deoxygenated blood is being directed into the pulmonary artery, which is then used to feed the lungs where it will be oxygenated. So this region is the heart flow region, and it's referred to as the infundibulum. And this is where we have the conus of the pulmonary trunk, And this right conus artery, because we say it's right, definitely we'll be having the left that will emerge from the left coronary artery. So it will be waiting for the branch from the left conus artery that would emerge from the left coronary artery for it to form an anastomosis with. And this is the kind of configuration that will be presented when the left conus artery comes and form an anastomosis with the right conus artery. And this is called the annulus of Viersen. So this is another fact that is good for us to highlight. So for the second branch is the SA synodal artery or the sinoarterial artery. The sinoarterial artery supplies, just as the name implies, the sinoarterial node, and this will emerge or originate from the right coronary artery in 60% of individuals. And this is the sinoarterial artery or the SA nodal artery highlighted here in blue, and this is how it emerges, and it goes through to the wall of the right atrium where it will be supplying the sinoarterial node. And if you look at it in this image, this is the sinoarterial artery, and you see it emerging from the posterolateral side of the right coronary artery. Remember, these are right coronary arteries. So you see it emerging at the posterolateral border or side of the right coronary artery. Of course, it's going towards the right atrium where it will be supplying the sinoarterial node. The sinoarterial node is a collection of specialized cells that is responsible for the initiation of heartbeats. They are also the pacemaker of the heart. And that is what the SA nodal artery is going to supply. More about the location of the SA node. In order to be able to establish where it emerges on the posterolateral surface of the right coronary artery, this is because of the region where it is located. You see it located at the upper junction between the opening of the superior vena cava and also the crystal terminalis in the right atrium. And that is why you see it emerging from the posterolateral side of the right coronary artery, then tailing towards the right atrium, where it's going to be supplying the sinoarterial node. So we've also established this in our lecture on the right atrium. If you go through that lecture, you will be able to understand specifically where the sinoarterial node is located within the right atrium. So it's good for us to establish that we have general emergence from the right coronary artery, but we should also be aware of the variation, just as we've stated in the SA nodal artery, is that its emergence from the right coronary artery is not in 100% of population. It is only seen in 60%, while the remaining 40% will emerge from the left coronary artery. So this is the SA nodal artery that emerges from the right coronary artery. And this emergence is seen in just 60%. It's also good for us to know that in 40% of population, it could emerge from the left coronary artery. So moving forward, the third branch of the right coronary artery is the right anterior ventricular branches. The right anterior ventricular branches, from the name, it emerges from the right coronary artery on the anterior surface and is supplying the ventricles. So this is how it emerges, highlighted here in red in this image up here. So when it emerges, it's going to be supplying the anterior wall of the right ventricle. So in this image down here, so this is the right anterior ventricular artery. So you see it going and tapping towards the right ventricle, where it supplies the anterior surface of the right ventricle. The next branch of the right coronary artery is the right atrial branches. From the name, it emerges from the right coronary artery. It supplies the right atrium. So this is how it emerges in this image here, highlighted in green. You see it emerging, and of course, tapping towards the right atrium, where it supplies the wall of the right atrium. In this image here, this is the right atrial branch. That is how it goes to supply the right atrium. The next branch is the right marginal artery, and this is the right marginal or acute artery, harrowed here in black. It is arcuate because it follows the arcuate margin of the inferior border of the heart. In this image down here, you see it tailing through the arcuate margin of the inferior border of the heart. So you see it running horizontally, and of course, finally branching up and tapping towards the apex of the heart. But it, of course, does not get to the apex of the heart. And where this supplies the lateral wall of the right ventricle. You can see that each of the branches from the right coronary artery is taking the different regions from the right side of the heart. So these are all the branches of the anterior region of the right coronary artery. They haven't talked about the anterior branches of the right coronary artery. The next branches that we'll be going to is the posterior branches of the right coronary artery. So the first branch at the posterior region that the right coronary artery gives is the right posterior ventricular artery. The right posterior ventricular artery, just as the name, it is on the right side, but it is at the posterior part. That means this vessel will be supplying the posterior surface of the right ventricle, just as the name implies. You see it emerging from this image highlighted here in red. It's going to supply the posterior surface of the right ventricle. This is the right posterior ventricular artery that is harrowed here in black, and you see it supplying the posterior surface of the right ventricle. So that is how that emerges. And the next branch is the posterior interventricular artery, because it is seen to pass through the interventricular groove or sulcus. So this is the posterior interventricular artery here, harrowed in black also, tailing towards the apex of the heart. So it originates from the cross of the heart. Remember, we said the cross of the heart is the junction where the atrioventricular groove meets with the interventricular groove. So this is the cross of the heart. So this is where it begins from. Now, of course, it tails and is being directed towards the apex of the heart. It does not also get towards the apex of the heart. So this artery will finally wait for branches from the anterior interventricular artery, which will be a branch from the left coronary artery, for it to form an anastomosis with. But we'll get there as we go through with this lecture. But just for us to know, this posterior interventricular artery or the posterior descending artery supplies the diaphragmatic or the inferior surface of the heart. So it supplies the surface of the heart where the heart is related with the diaphragm, which is on the inferior side. In 90% of individuals, this artery will emerge from the right coronary artery. It could also emerge from the left coronary artery in 10% of individuals. So for us to know. So just take note of this, that there are a bit of variation also in the emergence of the posterior interventricular artery or the posterior descending artery. And this can be used to establish the cardiac dominance. The establishment of cardiac dominance is very important in cardiac surgery, particularly coronary artery bypass grafting. So if it emerges from the right coronary artery, just as what is presented in this lecture, is going to be right dominance. But if it emerges in the other way around, that is emerging in the left coronary artery, is going to be left cardiac dominance. So just for us to know. But normally, what is commonly seen is for the posterior interventricular artery or the posterior descending artery to emerge from the right coronary artery. So this is where it begins from, this region that is harrowed, and you see it tailing towards the apex. The posterior interventricular artery also further gives off two branches, which are the septal branches. These are the septal branches here, harrowed in blue. These septal branches supply the posterior 1/3 of the interventricular septum. We know the interventricular septum is the septum that divides the right ventricle from the left ventricle. So at the posterior part, because this emergence will be behind, it's going to be supplying the posterior 1/3 of the interventricular septum. Then we also have another branch that could emerge from it, which is the AV nodal artery. The atrioventricular nodal artery could also emerge from it, which will be used to supply the AV node. And this is the AV nodal artery that is harrowed in yellow. And you see it emerging and, of course, supplying the atrioventricular node. The AV nodal artery will emerge from the posterior interventricular artery or the posterior descending artery in about 80% of population. So let's dive into the left coronary artery. We've talked about the right coronary artery, the branches that emerge from it in the anterior surface and the posterior surface, and the different regions of the heart that they supply. So let's go to the left coronary artery. The left coronary artery is also an emergence of the ascending aorta, just as what we have in the right coronary artery. So where specifically does the left coronary artery emerge from? We've said that it is the only branch of the ascending aorta, which are the coronary arteries, the right and the left coronary artery. So this is the aorta as we explained in our emergence of the right coronary arteries, which of course is a continuation of the left ventricle, where we have oxygenated blood that is ready to be taken through it to supply the different organs in the body. So we have the emergence of the left coronary artery also here, as we have the right here. So this is the left coronary artery that emerges from the ascending aorta, which is the initial segment of the aorta, for it to supply the left region of the heart. Using this image down here, we already talked about the three leaflets of the aortic valve. We say we have the right leaflet, we have the left leaflet, and we have the non-coronary leaflet. This is non-coronary leaflet because coronary artery does not emerge from this region, and that is why it is so tagged non-coronary leaflet. Where coronary arteries emerge from is from the right and the left leaflet. So going to the left coronary artery, the emergence of the left coronary artery is also above the left aortic leaflet, but it is seen to emerge from the left aortic sinus. Remember, we talked about the sinus, which is the space that is seen within this pocket-like leaflet. Because it's pocket-like, there's going to be a space within it, and this space, blood will be contained after the blockage of the leaflet, just to prevent backflow. And the blood contained within this space can then be directed into the left coronary artery. And this, of course, will only occur during diastole. During systole, there's going to be contraction. And contraction of the heart will also lead to the contraction of the vessels that are overlining it. And this will constrict the wall of the left coronary artery, preventing blood from flowing through it. That is just the basic. So we have the emergence of the left coronary artery from the left aortic sinus, just as we have at the emergence of the right coronary artery. Also to add that if you look at the configuration of the emergence of the right and the left coronary artery, you see that the left coronary artery is larger than the right coronary artery. This can also be justified. We know that the left side of the heart is larger and also muscular, and it is so because it needs to pump blood into the aorta, which needs to feed the different body organs with oxygen and nutrients. Unlike the right side of the heart that is directing deoxygenated blood just to the lungs where it will be oxygenated. Now, on the right side, we do not really need as much work as what is needed on the left side. So that is why the left side is more muscular and more larger, and that is why it also has a larger emergence of the left coronary artery, so as to be able to complement with this function. So let's go to the branches of the left coronary artery. Let's see how it emerges first. It emerges between the pulmonary artery and also the left auricle. This is the pulmonary artery, and this is the left auricle. The left auricle is an extension of the left atrium, which extends to the anterior part. We've talked about this in our lecture on the left atrium. Please kindly go and check that lecture up also to keep yourself updated. So this is the left auricle. So between the left auricle and the pulmonary artery, we have the emergence of the left coronary artery, and this is the left coronary artery. And as it emerges, you see it tailing out, and when it tails out, I see it dividing into two major branches, and these two branches include the anterior interventricular artery, and this is the anterior interventricular artery. You see anterior interventricular artery from the name, it passes through the interventricular groove, which is the groove that separates the right ventricle from the left ventricle. And you see it passing through this groove. This artery is also referred to as the left anterior descending artery because it is on the left side, it is on the anterior side, and you see it descending down. And that is why it is so named the left anterior descending artery, LAD. So you see it passing through this groove. So this is the first major branch of the left coronary artery. And of course, it gives off branches. This we'll get to as we go through with this lecture. Then the second major branch of the left coronary artery is the circumflex artery. And this is the circumflex artery here. That is also harrowed here in black. And you see this artery as it emerges from the left coronary artery. You see it passing through the left atrioventricular groove, or the left anterior coronary sulcus. And we've tried to establish why this is called the anterior coronary sulcus, because it allows for the passage of the coronary artery. And running through this part to be directed to the left region, where it then makes a turn in a circumflex pattern to be directed onto the posterior region of the heart. And that is where the name is grafted from, the circumflex artery, because it turns in a circular pattern before it is now directed towards the posterior region of the heart. So going to the branches, we already talked about the anterior interventricular branch of the left coronary artery that is also referred to as the left anterior descending artery. This is a large branch that emerges from the left coronary artery. And you see it descending, as we've said, in the anterior interventricular groove. And this is the anterior interventricular artery, just as the name implies. You see it tailing towards the apex of the heart. And you see it as it tails towards the apex of the heart, it turns, and you see it turning behind to reach the diaphragmatic surface of the heart at this point. And this is where it forms anastomosis with the posterior interventricular artery, which is a branch of the right coronary artery. Remember, we said that the posterior interventricular artery, or the right posterior descending artery, is tailing towards the apex, but it does not get to the apex. So it waits at this point. It is the anterior interventricular artery or the left anterior descending artery that gets to the apex and of course turns to the diaphragmatic surface to meet the posterior interventricular artery to form an anastomosis with. So this is the kind of configuration that is presented, and you can see it turning at this point just in the quest of forming an anastomosis with the posterior interventricular artery. So that is how it goes from there. So this is where it turns to meet the posterior interventricular artery. This artery supplies the anterolateral wall of the left ventricle, the apex, and also the anterior two-thirds of the interventricular septum. That means it will also be giving off branches that will supply these specific regions. And that will take us to the next slide. So let's look at the branches of the anterior interventricular artery or the left anterior descending artery, LAD. It has three subdivisions. The first one is left conus artery. Remember our right conus artery, which emerges from the right coronary artery. We talked about that in our slide on the right coronary artery. So we have the left conus artery. This is the left conus artery here, arrowed in black. It emerges from the anterior interventricular artery. So as it emerges, it is tailing towards the conus of the pulmonary trunk, which is around the infundibulum of the right ventricle. The infundibulum is the left upper part of the right ventricle, which is also referred to as the outflow region. So this region, you see it supplying the conus of the pulmonary trunk. And of course, it forms an anastomosis with the right conus artery. We already talked about this, that the right conus artery is waiting for the left conus artery to come and form an anastomosis with. Then the next branch is the septal branches. The septal branches also emerge from the anterior interventricular artery or the left anterior descending artery. So these are the septal branches. You see the septal branches perforating the wall of the heart and going to supply the anterior two-thirds of the interventricular septum. And we also have diagonal branch, and this is the diagonal artery or the diagonal branch. And this also emerges from the left anterior descending artery. And you see it running obliquely along the anterolateral surface of the heart, where it supplies this region. Then the next branch is the circumflex artery. Remember, we talked about the circumflex artery that emerges also from the left coronary artery, turning in a circumflex or circular manner to reach the posterior region of the heart. It also has its own branches that it gives to supply the different regions of the heart. So this is the circumflex artery, arrowed here. You see it passing through the left atrioventricular groove, turning posteriorly to supply also the posterior region of the heart. And this is it at the posterior part of the heart. You can see it tailing towards the posterior region of the heart. And where it supplies is the left atrium and the posterolateral wall of the left ventricle. So let's say the branches that it also beds to supply this region. The first one, we have the left marginal arteries. So this is one of the left marginal arteries here, arrowed in black, and it runs in an obtuse pattern. Remember, the right marginal artery runs in an acute pattern, but this runs in an obtuse pattern. And you see it traveling along the left margin of the heart towards the apex, supplying the posterior surface of the left ventricle. Then we have the left ventricular or posterolateral artery, and this is the left ventricular artery. This left ventricular artery will supply the posterior surface of the left ventricle and also the lateral wall of the left ventricle. Remember, we have the right anterior and posterior ventricular arteries, which are emergence of the right coronary artery. So then we have the emergence of the left ventricular or posterolateral artery from the circumflex artery. Then we have the last emergence, the posterior atrial artery. The posterior atrial artery is also here, arrowed also in black. You see it emerging and tailing towards the left atrium, where it supplies the wall of the left atrium with oxygenated blood. Then we also have two other branches that their emergence are variable, the SA nodal artery and also the AV nodal artery. We have the SA nodal artery emerging from the circumflex artery in 40% of the individuals, and we have the AV nodal artery emerging in the circumflex artery in 20% of the individual. We should take note of this variation. Remember, we already talked about the SA nodal artery in our branches from the right coronary artery, that would emerge from the right coronary artery in just 60% of population, but in 80% of population. So the remaining 20% will emerge from the circumflex artery, which is a branch of the left coronary artery. So it's good for us to be able to establish establish these variations. So going further, we've described the number of anastomosis that is created by the coronary artery, where one branch from the right coronary artery will form anastomosis with another branch from the left coronary artery. So one of these is the left and the right conus artery, which we established that will form anastomosis around the infundibulum of the right ventricle. Then we also talked about anastomosis between the anterior and posterior interventricular branches in the interventricular groove. So we have anterior and posterior interventricular artery also at this region, forming anastomosis here at the posterior part. Then we have another anastomosis from the septal branches, which emerge from the right and the left coronary artery, supplying the interventricular septum. So we have anastomosis also created between the septal branches. Anastomosis are interconnection between the walls of the vessels, so that if one region is blocked, blood will be able to get to that region through the supply from the other vessels. So that is the essence of anastomosis. In the wall of the heart, the anastomosis that is created by branches of the right and the left coronary artery are different from the normal configuration of anastomosis seen in different regions in the body. The anastomosis are anatomical anastomosis. They structurally present the configuration of anastomosis, but do not exhibit the functions that anastomosis exhibit. This is the kind of configuration that they present. At the point where they connect, they are very small and end arteries. So they are referred to anatomical anastomosis and are not functional anastomosis, because the caliber of the vessels at the point of anastomosis are not sufficient to provide the blood supply that is needed when occlusion occurs. And this is not what is supposed to be seen in regions where anastomosis are created. And the impact of this is myocardial infarction. And this occurs when there is insufficient blood supply to the region of the heart. And when this occurs, the other region that is supposed to be feeding it with oxygenated blood will not be able to do so because of the type of anastomosis that is created on the wall of the heart. So let's go to applied or clinical anatomy. So let's look at myocardial infarction. Myocardial infarction, we talked about this in our previous slide. It's also referred to heart attack or death of heart muscle. This is a medical emergency, and it occurs as a result of necrosis, which results from sudden insufficient blood supply to the myocardium. And when this occurs, the symptoms that will be experienced include pressure or tightness in the chest. There could also be pain, shortness of breath, dizziness, fast heart rate, and so on. And the causes of this include bad cholesterol, lifestyle factors. Treatment will include changes in lifestyle, cardiac rehabilitation, or bypass surgery. Angina. Angina is also referred to angina pectoris, which means chest pain or discomfort in the chest region. This may be caused when the heart muscle does not get enough oxygen-rich blood. And this will occur as a result of build-up of fatty substance within the interior wall of the blood vessels, which will lead to the narrowing of the lumen of the blood vessels, thereby reducing the quantity of blood that it is transporting, and is referred to atherosclerosis. And when this occurs, the quantity of blood that will be flowing through it will be reduced, and this means the heart muscle will not be able to get sufficient oxygen-rich blood. Then occlusion. Occlusion is blockage of the vascular lumen or canal. If you look at this configuration here, the wall of the blood vessels here is highlighted in yellow. So this is an occluded vessel, which is blocked vessel. The left interventricular artery, it could also be referred to as the left anterior descending artery. This is the most commonly occluded coronary vessel. It's referred to as window maker's infarction. Treatment is angioplasty. Angioplasty is a surgical procedure that is used to repair or unblock the vessel so as to restore blood flow. You could also do coronary bypass, where you draft healthy blood vessels from other regions of the body, like the arm, the leg, or the chest, and use it to reconstruct a pathway for coronary circulation. Enlarged heart. This is as a result of an increase in the structural configuration of the heart, and this occurs when the heart pumps blood harder than usual. When it begins to overwork itself, there's going to be an increase in its size. And the symptoms of this include shortness of breath, abnormal heart rhythm, swelling, and so on. The causes could include high blood pressure, heart valve disease, disease of the heart muscles, and at times, causes may not be established. Coronary angiogram. Coronary angiogram is a specific type of radiographic test or examination that is done to view the wall of the coronary vessel. And this is used to check whether there is occlusion or stenosis of the wall of the coronary vessel. And the region where we have occlusion or stenosis will be seen through this presentation. So thanks for watching. Let's meet again.